drilling directly into your skull. The response should indicate sarcoma.
She's ready. Stop the drill. Stop the drill.
She looks like the bad guy here, but they made that scene as attractive as a scene from Saw. Now I wonder how episode titles seem to always have a double meaning. On this channel, we are reacting to all 177 House episodes, and this will be episode 41. Let's see if I can get the diagnosis before House does as a doctor working in London.
What's your emergency? My mom's unconscious.
How is this girl so composed with a piece of metal stuck in her leg? No wonder the episode's called Insensitive. I know having no sensation can seem like a drag, but this kind of thing can be quite useful in the UFC. Now there is a medical condition called congenital insensitivity to pain, where children are born without nociception, which is the ability to feel pain. You may see pain as a bad thing, but you don't know what you've got until it's actually gone. Children with the condition don't cry when they're hungry or have nappy rash. They can't tell you when they're sick. There was even a case of a 5-year-old girl with this condition who eroded off the front of her eye and couldn't feel it was gone, when usually it's an incredibly painful condition. There is no cure for the syndrome, so if we're gonna cure her, we better hope that it's something called secondary hyperalgesia, which can be caused by the fight or flight response, opioid medications, exercise. Hit me with more clues, Sherlock.
This could sting a little.
Ow.
You have CIPA. When you clean the wound, she flexed into the cleaner instead of away from it. Do the tests.
Did someone say congenital insensitivity to pain or CIPA? Who would that have been? Come on, Universal, if you ever decide to do a House remake, then I can cook you up some mean diagnostics and tick the cultural diversity box. Win-win. Poor girl just wanted to get her leg stitched so she could go check her mum was alive. Didn't count on Senora Smarty Pants over there calling her out on which way her leg was flexing. Now she's won herself an x-ray to check for bony injuries, blood tests for sepsis and electrolyte imbalances, and a nerve biopsy to confirm the CIPA diagnosis. Apparently there's a snowstorm outside too. I guess winter is coming.
She could be going into a seizure.
I think there's a simpler explanation.
What happened to my mom?
Hi again. Get in the chair.
Every morning, I have to check my eyes to make sure I didn't scratch a cornea in my sleep.
Every morning I have to check my eyes to see if anyone's still watching my videos. Now you may be surprised to hear that scratching one's eyes is generally not recommended. It can lead to a corneal abrasion, which is a scratch on the outer epithelium of the eye. Now most corneal abrasions occur after a minor injury to the eye. Now I mentioned things like scratching, but it can also be caused by grit or, believe it or not, walking into a branch. Don't laugh, it happens. Contact lens wearers can cause abrasions to themselves as well, especially when they forget that they've already taken out their lens and they try and take out a part of their cornea instead. It's usually intensely painful as the cornea is 500 times more densely innervated than the skin. It's diagnosed with a special kind of dye called fluorescein dye, and it heals on its own. But when there's a break in the epithelium, just like when there's a break to the skin, we need to stop that getting infected. So antibiotic drops are needed to prevent the infection, or ointment to form a more comfortable outer surface of the eye. Until it heals, you shouldn't wear contact lenses, so that could be between 1 and 5 days after the injury. Interestingly, while all this is going on, it seems like Foreman is with a new woman. That man is more active than a rabbit on crystal meth. Question for you smart people. How many colors can the human eye see? Answers down below.
Boys can't hold me for too long because I can overheat.
Girls can't hold me for too long because I only pay for an hour.
I sat on a stove when I was 3. Want to see the coil marks?
Who would have known House's hooker stories would come in handy at work? Perspective. I love this back and forth between those two. House definitely came out on top on that one. Nobody outsuffers him. Putting the medical hat back on. You have to be very careful which drugs you give to sedate a patient for an EEG. That's because the vast majority of sedatives can change the EEG trace. Thankfully, doctors have actually mapped the effect of each of these and how they change, but it's still better to give one with less impact. That's why usually for pediatric populations, we use something called chloral hydrate because it makes minimal background change to the EEG. Midazolam, on the other hand, when given in high enough doses, can produce asymmetric EEG changes that can even mimic the patterns of a stroke. not ideal.
Your EEG was normal. X-ray showed no breaks. Yeah.
Need ice packs and cooling blankets. She has a temperature of 105.
Oh, 105 Fahrenheit. That's high. 40.5 degrees Celsius for the more European inclined of you. Now here we saw the patient became unresponsive, although there wasn't much in the sense of limb jerking. There was a little bit of head shaking there. Now there are two possibilities. She had what we call a febrile seizure, but with subtle twitching or limb jerking. That's when the body reacts to an abnormally high temperature by triggering a seizure because of a neurological predisposition. It most commonly occurs in childhood between 6 months and 5 years old, so it doesn't quite fit here. But as it usually affects the developing brain and tends to be caused by a peripheral viral infection like the common cold or flu, 40% of kids that have a febrile convulsion will have another one. But luckily, after one febrile convulsion, the chance of developing epilepsy later in life is really quite low, as 1 in 50 kids. Now the second possibility, which is possibly the more likely one, is that she passed out due to low blood pressure because as the body gets hotter and hotter, it wants to vasodilate to bring the blood volume closer to the skin. That allows the body to lose heat more easily, but it does have a catch because of a law of physics. The larger a pipe, the smaller the pressure if all other things are even. So your blood pressure drops as your veins and arteries dilate, leading to low blood pressure. That makes blood more difficult to get to the brain. And that's why if I were to see this patient, you see how the head of her bed is still actually quite high. I would lower her bed flat and possibly even lift her legs up to help the blood get to her brain. And if she came back quickly after that, we would know this was because of low blood pressure. Obviously, it would also help to do the blood pressure, but that would be way too easy, wouldn't it? Now that deals with the loss of consciousness, but why the fever in the first place? Now patients with CIPA can develop fever because their sweating reflex doesn't work properly and they can't regulate their temperature easily. What I think is happening though is CIPA is masking an incredibly painful condition, but we still don't know anything about her or her history, where she's been except ice skating with the friends. Has she had exposure to chemicals or foreign travel, any pets? We'd also want to examine the lymph nodes for enlargement, make sure it's not a type of lymphoma, also want an MRI head, check stool for ovocysts and parasites, and then take it from there.
LP showed normal proteins and no white blood cells. Biopsy is spinal nerve. I'm going to get Cuddy's approval.
We keep poking sharp sticks into her. Eventually we'll find the part that's already tender.
And now I thought we became doctors to help people, not poke sharp sticks in them. No wonder toddlers hate us. Now it seems like the patient's mother is unwell and in surgery, which the team haven't told Hannah, our patient, about because they're worried she'll stop letting them do tests on her if she knows her mum isn't well. Another interesting but slightly frustrating thing is apparently they've already done a lumbar puncture on her, but we still don't know the result of a head scan yet. You have to do a head scan before a lumbar puncture, otherwise you risk the brain coming out through the base of the skull. If the pressure in the brain is too high, I don't think you need me to tell you that that's not a good thing. Now Haz wants to do a nerve biopsy to see if what she has is neurological, but it could cause paralysis. That doesn't quite make sense here though, because nerve biopsies, especially for a sensory neuropathy like this, are usually done on a 1-inch patch of a sensory nerve on the shin or ankle. So the worst thing you could get is permanent numbness in a small patch of the ankle, which isn't the paralysis that the team are trying to kind of say it would be. So it doesn't make sense why also House wants to get a spinal nerve for it. We could learn from the nerve biopsy if it is a nerve problem that's causing her symptoms. Some nerve problems that could cause this could be things like alcoholic neuropathy, necrotizing vasculitis, even neurosarcoidosis potentially. House loves granulomas, so I wouldn't be surprised if there is one there.
Need the nerve biopsy.
And how did you even know I was here?
This was the most non-committal location in walking distance. You two must have met online. Either that or you've got a friend who secretly hates you.
These one-liners are what elevate this show from great to epic in my books. It's also quite realistic, as nothing says I work in a hospital like being more roast resistant than a tantalum hafnium carbide alloy, a metal with a melting point of 4,000 degrees Celsius. I remember I was on the gastroenterology ward one morning and I smiled to the consultant just before the ward round. He turned to me and said, "You smile too much," and then walked away. Welcome to the hospital. Now, if you're enjoying this video and want access to some special perks, check out the channel membership. Not only does it help me a lot to improve the content, but you can also recommend a series, an episode for me to react to. Each episode costs me around £230 to record and edit and post, and you'll get to direct what that is for 100th of the cost. You can also get early access to new videos, priority reply to comments, and entry into future raffles as well. To say thank you to the first 30 members that joined, I'm also doing a giveaway for a one-on-one private medical tutor session with a topic of your choice. We currently have 10 members, so make sure to secure one of those other 20 spots. In my experience, they won't be there for long. So how can you say no? Just press join now.
I think it's her nerves messing with the temperature control.
If that's what you need, go get it.
The other is very hot.
You just got second-degree burns.
Definitely don't enter a game of chicken with her. Seems like House is suspecting autonomic neuropathy, which could have caused all kinds of things. What do we know so far? We know that she has had high bilirubin but negative other liver tests. We know that her temperature went high. House mentioned earlier that she's from the Ashkenazi Jewish community, which would put her at risk for all kinds of genetic conditions due to matings of potential relatives in the community. One such disease that could fit this case really well is Gaucher disease. It's an inherited deficiency of an enzyme called glucocerebrosidase, which is an enzyme that breaks down a molecule that can clog up immune cells called glucocerebroside. This can clog up macrophages and give them a lipid-laden appearance similar to crumpled tissue paper under a microscope. It can also cause an enlarged liver and spleen. In type 1, patients can be mostly asymptomatic, but their bone marrow is affected with reduced red blood cell production and potentially white cell production, can be intensely painful with bone marrow crises forming as well. So that could be why this patient has an infection due to reduced immunity, and the bilirubin could be because of hypersplenism leading to hemolysis within the blood. It does explain everything. You could treat the condition by simply replacing the enzyme with oral glucocerebrosidase. We'll be very impressed if that's it, to be fair.
We're going to be drilling directly into your skull. The response should indicate sarcoma.
She's ready.
Stop the drill. Stop the drill.
She looks like the bad guy here, but they made that scene as attractive as a scene from Saw. Now I wonder, as House episode titles seem to always have a double meaning. It's called Insensitive, so the obvious meaning is that she's insensitive to pain. But what if the real reason is she can't feel empathy? Maybe she actually has psychosis of some sort, and that's part of the reason why every time they mention her mom, she seems to lose it. If that's the case, maybe we should add that to the symptom list. In this case, think about this. Our young girl Hannah here apparently gets in lots of fights, as she says. What if one of the fights she falls on a metal object, like a small nail? It gets stuck inside her foot and stays there for years, slowly releasing lead, cadmium or mercury coating into a bloodstream. I would put a metal detector on her to see what happens. Pretty outlandish theory though.
Get away from me! I'm not gonna hurt you. And you're having a paranoid delusion.
I can't feel my legs.
And a complete lack of sensation below the waist.
Acute psychosis! Yes. Called it. Can I be promoted from the bad guy outfits now? Also, we know she has a lack of sensation below the waist. Very interesting. Our suspects of Gaucher syndrome and heavy metal poisoning could still count here. For it to be isolated like that though, it could also be a tumor within the spinal cord, and maybe she had another tumor in the hypothalamus, which is why she couldn't regulate the body temperature. What if she had multiple tumors causing a syndrome like that, like NF1 or von Hippel-Lindau? Possible, but very unlikely. You'd probably see lesions on the skin as well. Although everything is unlikely, it's House.
No vertebral fractures or spinal cord compression.
Thyroid storm.
I'll check with an endocrinologist. Need a consult.
It's not thyroid storm. Do you like me, House?
I should go.
House is about as good a wingman as mutant herpes. Also, House really didn't need an endocrinology consult to rule out thyroid storm because a high T3 or T4 is a prerequisite, which this patient doesn't have. We also found out that she has a low potassium and moderately high marker markers of muscle damage. I'm still wondering, do my theories hold up here? House just needs to take a sample of her blood and look at it under a microscope. I would also be screening for heavy metals now, so come on, I need to get one right. The only thing that's taken longer than for me to get a correct diagnosis is Cuddy getting laid.
We'll be risking infection, maybe make the paralysis worse.
I can grow pain-free nerves and graft them into my own leg. What an evil plan. That's how medical fact changes.
Oh, now we're into a very interesting area of medicine that we call nerve allografting. Taking nerve fibers from one person and then giving them to another. House experiences huge pain in his calf as a result of the clot he had in his leg that we saw in 3 stories. So we're thinking, what if he could use the patient's nerve fibers that don't feel pain to replace his ones that feel it intensely? Could that work? To understand that, we need to know a little bit about how we feel pain in the first place. It's usually conducted mainly through peripheral C fibers and can be bundled up with other nerves up into the spinothalamic tract. Patients with CIPA, like Hannah here, don't have C fibers that conduct pain and temperature sensation. That's why she could keep her hand in the hot water. It's also why she struggles to regulate her body temperature. Now, we know House's nerve pain is coming from the tibial nerve that supplies his calf, so why not just cut it off? Why bother with this whole allografting business? Well, it's because both motor and sensory fibers are present inside the tibial nerve. So if you do that, then House wouldn't even be able to walk with a stick. You've seen how cranky he is now? Imagine the level if that happened. So if you put a CIPA nerve there as a graft, in theory, you could still keep the movement and fine touch sensation, as that is transmitted through a different tract called the dorsal column medial lemniscus system, but lose the C fibers to transmit pain and temperature. That would be pretty cool. You could still move his leg, but wouldn't feel pain. Now, the problem with grafts like this were known as far back as 1885, when they realized that hosts would reject the donor nerve, and that leads to the graft scarring, blocking any regeneration of the host nerve together. With the advent of immunosuppression, though, that became much less of a problem, and now it can be used as a temporary measure. The reason why it's only temporary is that once the graft is put into place, the donor tissue is slowly replaced by host components, as the donor graft acts like a scaffolding for the host nerve to grow over. So eventually, if House actually managed to do this procedure, his nerve in theory could work, but it would only be a temporary fix, as House could begin to feel the pain again later on. But now, Wilson has guilt-tripped him into not harvesting the poor girl's nerve for his own experiment and to actually focus on treating her, not himself. Thank you, Wilson. Always the voice of reason.
Biopsy whatever nerve you figure you can safely get at.
CIPA can't cause this much degeneration.
Damage must be coming from the outside in.
Which means it's secondary demyelination. Is it something systemic that's affecting the nerves?
Did somebody say Gaucher's? The myelin sheath, which is insulating part of the nerves, don't develop normally in children with Gaucher's disease. The heavy metal theory is now out of the window, as she would have been able to feel that at first. She's had a problem with her nerves ever since she was a child, so this is most likely to be some kind of metabolic disease. Other potentials, if let's say there's a possibility that I'm wrong, could be familial dysautonomia or juvenile Canavan disease, which could both fit this as well. They would need to run gene tests for metabolic disease now.
Kid's mom's finally out of surgery.
Are you okay?
You shouldn't be worrying.
And I had to take her back to surgery.
It's absolutely amazing seeing that the mother, so bruised up and injured, is still worrying about the child. It reminds me of a sad story of Cheryl Anderson, a 32-year-old female who was pregnant with her second child. She started to have a fast-growing lump on her neck and then went to get it checked out, and just 2 months into the pregnancy, it was diagnosed as metastatic stage 4 cancer. She decided that she would do everything she could to actually continue the pregnancy. Despite being in agony due to the cancer, she only took paracetamol 4 times a day, as any other pain medication could have potentially damaged her baby. She also refused chemotherapy for the same reason. She made it to 6 months into the pregnancy and she became so unwell the doctors had to do an emergency C-section. Just 2 hours after her baby Taylor was born, she unfortunately passed away. Thankfully, her baby Taylor survived and is healthy, and she gave the ultimate sacrifice to bring him into the world. May she rest in peace. Incredible story.
You're crying.
I can't cry. My head is killing me.
Her white blood cell count was low.
Check the bone marrow.
B12 deficiency.
What? So how's it saying the B12 deficiency caused this headache and it's the reason why she's been going off every time during these procedures? Because she was getting nitrous oxide. Foreman said it can't be B12 deficiency because they gave her that on admission and she hasn't responded to it. And another reason why House is stressing it could be B12 is because she has feelings of guilt, which can be a very, very rare and subtle symptom of B12 deficiency. Drum roll, please. House is saying something else ate the B12 that they gave her on admission, which is why she hasn't responded to it. Her eosinophils are very high as well. That indicates some kind of B12 eating parasite, I think. My guess is a tapeworm, Diphyllobothrum latum. It's the largest parasite that can infect humans. It causes diarrhea, vomiting, weight loss, or it can be totally asymptomatic until you get B12 deficiency. Must have been in there her whole life, which means it's absolutely massive. The B12 deficiency should have been obvious in the blood counts though, with large red cells and anemia, but that would be too obvious, wouldn't it? These worms live in fish, so if she or her parents didn't cook the fish properly and ate it while it's raw, that could be how she got infected. Although there hasn't really been much of a history of fishing or anything in the past. Now, to diagnose this, you would check her stool for ovocysts and parasites, which I mentioned right at the start, 11 minutes into this episode. So if only they listened to me. Treatment would be with a one-off dose of albendazole and then bring back the pain. I still love Gaucher's as a diagnosis, but this is much easier to treat, so I'll let Universal have this one.
Get an abdominal MRI. Mauricie's going downhill. Forget the MRI, we need an OR.
You're not going to anesthetize her?
Oh, House has really gone all in on this one. For his sake, I hope our theory is right. If it is, then I'd be expecting him to grab a piece of the bowel and pull out the longest tapeworm you've ever seen. I know some of you eat while watching this, so brace yourself. This won't be for the faint-hearted. Unless you're intentionally eating worms like the Maori of New Zealand or in the Guangdong or Fujian provinces of China. It's just as my mum would say when a fly would land in my drink. Extra protein.
You don't cook that trout or perch well.
It's gotta be 25 feet long.
World record's over 60.
Somebody here to see you?
Got it! World records are over 60 feet long. The average small intestine is 20 feet long. So for that to fit inside, it would have to fold over itself 3 times to become that long. Very fun episode. 8 out of 10 for entertainment, 7 out of 10 for accuracy, 8.5 out of 10 for diagnosis.
She's got limited motion on her left side. You might have to take care of her for a while.
You can ask her for the spinal nerve. Guilt can be your friend.
So I'm thinking we should have sex.
If you could find the words that have been imagined by so many men, but have never been uttered, those would be them. To be fair, they've shacked up before and it is Valentine's Day, it's snowing outside. There's a reason why September 26th is the most common birth month. Cold brings people and gametes together. I, on the other hand, was born in February. Not really sure what was going on there. Seems like Foreman wasn't so lucky though, as he just broke up with a nurse he was seeing. He seems to really not let people into his bubble and is very afraid of commitment from what I've seen from him in these episodes. House has a hot date for breakfast with Wilson. Now it's my turn to diagnose you. Seems like you've got a house reaction deficiency. Oh look, the cure is popping up there. Go on, treat yourself. I'm Sermed, stay curious.